Have you recovered?
Very fast. Thank you very much, Mistress of Ceremony, Your Excellencies, colleagues. I'm not sure after this video whether there is much for me to say, but let me say that the topic is about leadership in vulnerable medical male circumcision. And perhaps the first thing to do is to reflect on what is leadership in the context of what we are discussing today. Nothing is all about organizing people to achieve a common goal. And this is exactly what we try to do in Zimbabwe. The common goal globally is that we need to circumcise men towards achieving zero new infections, towards achieving zero new deaths because of HIV, and towards achieving zero discrimination. The network that I lead in Zimbabwe, ZIPA, Zimbabwe Parliamentarians on HIV and AIDS, came as a result of realizing that we, the elected representatives of people, have been all along together with other leaders above us, talking, putting policies, and a number of other things. But there was a yawning gap that we thought we need to fill. And that yawning gap was that we were not actively practically involved. We were not leading in the front as leaders. And therefore we realized that we needed to be part of the active involvement. Talking about people in HIV/AIDS with the people and not talking about HIV and AIDS without the people. And that's what we set to do. On the 22nd of June, last month, as has been illustrated by the video, 120 MPs, members of the ZIPA, went for voluntary counseling and testing, public as it were. And not only 23, as has been mentioned in the video, the number later on went to 35. The good part is that when we set to carry out this program, the major objective was that we want to inspire those that we lead so that they follow suit. And together we can accomplish that. And guess what? On that very day, addition to 120, we had 188 members of public joining us. We went for VSAT. That was for voluntary counseling testing. And we had also 7 members of the public joining us for the voluntary medical male circumcision. And that included the national board chairperson of the Zimbabwe National AIDS Council. And one journalist who was covering the event who said, no, if Blessing more than 50 has done it, why not me 29? And that was a plus for us. That then was an indicative that what we set to achieve, to demonstrate, to lead in the front, to inspire others, could therefore achieve that goal. When on the very particular day, 188 public members joined us, and when 7 members of public joined us for MC, it was an indicative that what we said to do was really going to achieve. Way forward. But before way forward, I think we were very much inspired. You saw the Deputy Prime Minister, the Speaker, and the other high officers coming to partner with us. The Deputy Prime Minister of Zimbabwe is here with us. Maybe she's not in this room, but she's elsewhere. And that was an inspiring also leadership above us. Working with and collaborating with PSI, the Ministry of National AIDS Council, and others, we are facilitating for the citizens of Zimbabwe to partake and team up with us. We have a way forward that we have put in place after that event. We are going to mobilize the 276 traditional leaders of Zimbabwe chiefs, We are going to mobilize more than 2,000 elected ward councillors in Zimbabwe. We are going to mobilize some of our fellow MPs who have not joined us so far. And we are going to intensify the advocacy program to make sure that we aid, we complement together collectively, we achieve the 1.2 million target for boys and males and male members to be circumcised by 2015. A program that is being driven by PSI and supported by the ministry. And we hope that we will add so much to that effort. We want to thank you for listening. Thank you very much.
This is for you or anyone else. We started a pilot project when I worked for USAID in Lusaka, Zambia, 9 years ago, not for HIV prevention, but male circumcision for just general reproductive health, and many, many men came. Then we did a study in Harare, Zimbabwe, published in 2006, finding that many men were interested in circumcision for reasons related to hygiene and less STDs. I have an article coming out tomorrow in the LA Times, Los Angeles Times. If you want to read it, I talk about the experience we had in Swaziland, starting in 2006, where we funded a small program. And my question is, what would happen if we made male circumcision very widely available, safely and affordably or free, but not overly linked to HIV prevention, just as a general male health service? Our experience in those countries is that many, many men would come anyway. I understand that the program in Tanzania now is actually going to start doing that. The Hopkins program will start emphasizing hygiene and other aspects, not just HIV prevention. Thank you.
Okay, sure.
I think what is desired is to have many men and the boys take up male circumcision. And I believe that is what we set to achieve. When we have done that, it means that we will be able, as a country, to achieve the goal for which we have started that program. I think one of the challenges that we will face, and if time was there, I was going to talk about it, is if more people with this massive program that we have undertaken come forward, are we going to sustain it with funding? That's another thing. And that has to be looked into along the lines that the Deputy Minister from Kenya have said. We need to have internal funding for that process.
If I could just ask you to let the gentleman behind you have the next question, since you've had one question before. And we only have time for one more question, sorry.
My name is...
Yes, that's what I'm just, that's why I asked you to let the gentleman, I'm sorry, yes. All right, go ahead.
My name is Ernest Waitito with Internews. My question is, how do you galvanize 35 parliamentarians to come and get circumcised? How do you do that? And how did you do that?
Mobilizing, organizing people to achieve a common goal is a matter of strategy and tactics. And you have to take into consideration the obtaining political environment, social environment, legal challenges. But it's all about situational. You see the situation, then you say, how do I act, how do I convince this? It's actually a process. It took us 2 years to convince each other, but I had to employ, personally as a leader, strategies and tactics, making the group accept that it is a decision collectively that we've made. Pronounce it in public, and it's difficult for you to rescind or to go against that. And this is what we did.
I'm sure you'll have the opportunity to speak with him later. I'm sorry, there are other speakers who still have to come forward. Our next speaker is the Honorable Professor and Dr. Christine D.J. Ondoa. She now is the Minister of Health in President Museveni's cabinet And she also serves as a member of parliament. And she can talk to us about political leadership and why it's important in promoting voluntary medical male circumcision. And I would also ask her to address the question of what happens, once the funding for projects ceases. I think she's in a key position to be able to answer that question.
Thank you, Your Excellencies, distinguished guests, ladies and gentlemen. My topic is about Uganda's experience on leadership and voluntary medical male circumcision. Uganda, about 20 years ago, had one of the highest HIV/AIDS prevalence in the world. And we managed to reduce the prevalence of about 18% to almost 6% because we had leadership. Our president personally took commitment to do that generally. And even now, with the voluntary medical male circumcision, he has personally involved himself into taking that leadership and making sure that as one of the preventive measures, this is done in our country. Since voluntary medical male circumcision is one of the preventive tools, a high level and strong leadership, as I mentioned, plus political commitment is very, very crucial. However, for this to be successful, leadership involvement requires different leaders at various levels, namely at the national level, at regional level, district level, and local levels. Now, what kind of leaders are considered in Uganda for the voluntary medical male circumcision? We have the political leadership, like the head of state, as I have said earlier, the ministers, the members of parliament, opinion leaders, and so on. We also need the administrative leaders, like the mayors, opinion leaders, the religious leaders, the funding agencies, and traditional leaders, as we heard the previous speakers share their testimonies. The specific roles that our leaders play in VMMC act as national champions to promote the voluntary medical male circumcision. And our former vice president shared that with us previously. The leaders also need to provide guidance, oversight, and direction on male medical circumcision, to provide support and encouragement, as my colleague had just shared, and also lead by example. Again, the previous example is very, very clear. We also need to do resource mobilization, because as the question was posed to me, what about when the donors and the supporting agencies stop? What else? So we need to mobilize those resources as in country and also be able to sustain it. Furthermore, the opinion leaders of the societies can extend words of support that encourage people to embrace the medical male circumcision. Now, what is the experience of Uganda on leadership? That is, what are some of the specific examples of what leaders have done in Uganda concerning medical male circumcision? Starting with the political leadership, His Excellency the President of Uganda launched a new national prevention strategy for HIV. The strategy, among others, underscores the need for voluntary medical male circumcision. Secondly, Her Excellency, the former Vice President, Dr. Speciosa, who spoke earlier on, is also our national champion for an HIV-free generation. She's very supportive for this medical male circumcision. The Parliament of Uganda is also very supportive. The Parliament hosted a circumcision camp in Parliament Garden in December last year. Within a period of 3 days, close to 400 people were circumcised at the camp. And what about the Ministry of Health as leadership? What are we doing? We are leading the National Voluntary Medical Male Circumcision Program. This has ensured that Uganda's program is country-led. We are providing overall coordination of work of all the circumcision stakeholders and implementing partners. We developed and launched the National Voluntary Male Medical Circumcision Policy to provide overall guidance and framework for implementing the MMC services. We also developed and launched the National Voluntary Male Circumcision Communication Strategy, which provides technical leadership and developed technical guidelines. And we are promoting this under the public-private partnership umbrella. And the Ministry of Finance in my country, for this financial year, the Minister of Finance announced the support of the Ministry of Finance toward HIV/AIDS prevention care, and that includes the safe medical circumcision. At the local government level, the following leaders have also been playing some key roles, and this came after they were engaged by health care professionals. We have the Alliance of Mayors and Municipal Council Leaders on HIV/AIDS, the Interreligious Council of Uganda. Most of the high-level leaders of the Interreligious Council have been sensitized and are now actively supporting the voluntary medical male circumcision. Our traditional leaders in circumcising communities have also fully embraced this, and they are leading by examples. Another important group of leaders are the health development partners, like the World Health Organization, USAID, CDC, PERFAR, and others. And in conclusion, ladies and gentlemen, I would like to reaffirm that Uganda's leadership will continue to support voluntary medical male circumcision to ensure that it is scaled up and is covered significantly increases. Currently, the prevalence of male circumcision among adults between 15 to 49 years is only 26%. But we will continue to work with leaders at various levels so as to improve these indicators. We will also continue to collaborate with international partners through the private-public partnership for health. I want to extend my appreciation for the organizers for inviting me to speak at this occasion. I thank you.